Hello and welcome everyone to another lecture in GI system, and today I will talk to you about the pancreas. So guys, I would like first to let you know that the pancreas is exocrine and endocrine gland. So what does it mean? That means the pancreas has cells that responsible for secreting enzymes into the blood that represent the endocrine part, and cells that responsible for secreting another secretion, I would say, to the GI system, gastrointestinal system or gastrointestinal tract. So guys, the pancreas is exocrine and endocrine gland, and the exocrine portion of this gland, guys, uh, you know, it produces like secretions that contains enzyme. These enzymes, guys, are capable of hydrolyzing protein, carbohydrates, and fat. So these secretions will be secreted in the second part of the duodenum in the GI tract. But on the other hand, guys, as I mentioned, it has cells clustered like in islets, as you see here. These islets, known as islets of Langerhans, these islets composed of bunch of cells. I will talk about it briefly because it should be covered in histology. So these islets of Langerhans compose a bunch of cells and secreting enzymes and hormones secreted into the blood. That's why it's known as endocrine part, because it secretes into the bloodstream. So some like example of these enzymes are the secreted by the endocrine part or islets of Langerhans are the insulin and glucagon. They are very important. So mainly, guys, I would say roughly 99% of exocrine cells of the pancreas are arranged in cluster known as acini. Look at the here. These the acini, guys. This is the acinus. So these represent the exocrine part that secrete, I would say, enzymes to the second part of the duodenum. But look at this one here, guys, which like an islet here. This islet, an example of endocrine cells. This is the islet of Langerhans that composed from bunch of cells. For example, it has alpha, beta, D, and F cells. And here, guys, most importantly, look at the abundance or numerous number of beta cells that are responsible for secreting insulin. Very important. That means beta cell responsible for insulin, but alpha cells, like see here, which is less in number than beta, they secrete glucagon, insulin, to lower the blood glucose in your blood, but the glucagon to raise the blood glucose. Now, let us shift now to the anatomy part, which is mainly we'll talk about today. So, the location and description of the pancreas. I know you can't see now the pancreas because it's covered by the stomach, as you see here. But I would say for now, I will show you after a couple of slides. This is the location of the pancreas. So the pancreas located in the epigastric region, and mainly in the, I would say, if this is the umbilicus, yes, so in the left upper quadrant. So this is the location of the pancreas. Well, guys, I think you cannot see the pancreas because it's located behind the stomach, but look at the shadow of the stomach here, and this is the pyloric plane that passes through the pylorus of the stomach, which is at the level of L1. So I would say now the pancreas located at the pyloric plane L1 and plus, I would say, L2 behind or posterior to the stomach. And although it's not easy to show it in this figure here, but it's good to know that the pancreas, guys, located between the concavity of the duodenum here on the right and the spleen here on the left. So let me show you here again. This is the concavity of the duodenum, guys, in which the head of pancreas located there, and this is the spleen on the left side, in which the tail of the pancreas lodged there. So this is a fantastic figure, guys, in which look at the stomach here. We cut the stomach because the stomach, I would say, like this. So look at the pancreas, which is located behind it. But what we can conclude from the figure that we see, look at the peritoneum. This is the look at the peritoneum that's cut in here. This is the peritoneum that cut in here. Although this cut which here represent the attachment of transverse colon or the transverse mesocolon, the peritoneum that fixed the transverse colon to the posterior abdominal wall. Anyway, I think you remember from the peritoneum, the lecture of peritoneum, guys. Anyway, look at the peritoneum. So look at the pancreas that's located behind this cover of peritoneum. So the pancreas located behind the peritoneum. Okay, this is the first point I would like guys to know. And look at its location behind the stomach. So we cut the stomach to see it. This is number one. Number two, in the concavity of the second part of the duodenum, or you can say the concavity of the duodenum in general on the right, and you have the tail of it which extends to the hilum of the spleen on the left. Now for I would say for descriptive purposes, guys, the pancreas divided into 4 parts, as you see. You know, before the pancreas, your body, if you look to your body, you will see that you have a head and you have a body, and between your head and body you have a neck, constricted part, right? So similar to you see in the pancreas. So you have, guys, the head and you have the body as well, right? So between the head and body you have constricted part, which is the neck, and of course it has a tail extended to the hilum of spleen. So it has head, neck, body, and tail easily, but plus it has a small process extended from the head to the left, which is the known as uncinate process of pancreas. So here is in the caliper, guys. Look at the stomach reflected up in order to show you the pancreas that's located behind it, and look at the uncinate process. Look at the head, guys, neck, body, and tail that's extended to the hilum of the spleen. This is the spleen, guys. And look at the concavity of the duodenum. This is the concavity of the four parts of duodenum: first, second, third, and fourth part. So this is again the location of the pancreas. That, of course, it was covered by peritoneum, so we removed the peritoneum to show you the pancreas. Now we start with the first part of the pancreas, which is the head. This is the head. First of all, look at it here, which is, you have not to forget that it's located like within the C-shaped concavity of the duodenum. Of course, you look at these vessels, guys, the superior mesenteric artery and vein, and you know that the superior mesenteric vein located to the right of the superior mesenteric artery. However, the head of the pancreas is located now to the right of the superior mesenteric vein, and posterior to the head, guys, you would see that there are a couple of structures posterior to the head. First of all, the inferior vena cava here, as you see, and you have the bile duct, and of course this is the right kidney. Yes, so you have the right renal artery and veins. Of course, these structures, guys, if you have a cava, bile duct, and renal artery and right renal artery and vein located behind the head. But also, guys, look at the from the head, you have this process that projected from the lower part of the head to the levet, which is the uncinate process of the pancreas. Look at the uncinate process. Look at its relation. So it's the uncinate process, as you see, located posterior to the superior mesenteric vessels. The superior mesenteric artery will pass anterior to it, and also the superior mesenteric vein will pass anterior to it. So the uncinate process located behind the superior mesenteric vessels. This is about the head. Now, what about the neck? That's we consider the constricted part of the pancreas that connects, of course, the head to the body. And if you look at it here, guys, you will find that's behind the neck, which is very important. The superior, I will use this pen, the superior mesenteric vein united with the splenic vein. This is the spleen, and there is vein that passes behind the tail and body of the pancreas until it reaches the and join the superior mesenteric vein, and they form very important vein that drains the blood from the whole of your GI system, which is the hepatic portal vein. This is the portal vein. Look for this one. Yes. So this is the portal vein. So I would like guys to know, which is very important, that the portal vein formed behind the neck of the pancreas. Behind the neck of the pancreas. Formed by what? By the union of superior mesenteric vein and the splenic vein behind the neck of the pancreas. Look at the inferior figure here. We cut the neck and part of the body of the pancreas. Look at here, we cut it from here and we cut it from here. So in order to show you the splenic vein, guys, that united with the superior mesenteric vein behind the, if you look here, so it's behind the neck of the pancreas to form the portal vein. So the portal vein formed behind the neck of the pancreas. Well, guys, I would like here also to say, yes, the superior mesenteric artery, yes, behind the neck, of course. Behind the neck, you see here's the aorta, right? This is the aorta, the abdominal aorta. So from the head body, let us shift to the neck. From head neck, let us shift to the body, sorry. And you know, guys, the neck, or the body of the pancreas, and in general, but mainly the body of pancreas, which is separated from the stomach by the lesser sac. So look at the peritoneum. Let me remind you, this is the peritoneum, the membrane that covers the some of organs in the abdomen, and it's reflected now here. Anyway, so look at the pancreas in general, located behind the peritoneum, and look at the visceral peritoneum. Continues, it covers the posterior surface of the stomach, as you see here, and covers the part of the here pylorus as well. So look at the space that's created here. This space is the lesser sac, small sac space, so, or omental porsa. So this space separates the pancreas from the stomach anteriorly. So you can insert your finger, as I told you previously, in this opening. So this opening is the foramen of Winslow, or the omental or epiploic foramen. Epiploic foramen. You can insert your finger here. Anyway, so posterior surface of the pancreas not covered by peritoneum, as you see here, because you know the the pancreas is retroperitoneal, behind the peritoneum, so nothing behind it except the couple of organs, structures, and the posterior abdominal wall. However, so there is no peritoneum here, but it's related to the aorta, to the splenic vein, to the left kidney, and of course above it left suprarenal gland, and the I would say the origin of superior mesenteric artery. So this is the body of the pancreas. Now lastly, which is important, the tail of the pancreas. Look at the tail. Let me show you the shadow of the upper pool of the left kidney. This is the upper pole of left kidney, and this is the left suprarenal gland, and of course this is the spleen. And if you dig deep, guys, you will find there is a ligament between the kidney and the spleen. This ligament, which is thickened or thickening of peritoneum, so peritoneum that thickened there form ligament. This is known spleno-renal ligament or lieno-renal ligament. It's up to you. So the spleno-renal ligament between the spleen and left kidney, you know, it includes the tail of pancreas. So this is the tail of pancreas that lodged there into this ligament, spleno-renal ligament, and it's very close to the hilum of the spleen, as you see. Well, guys, the tail of pancreas related to the splenic flexure of colon, right? Or splenic flexure, yeah. So this is like better review here. You see the left kidney, left suprarenal gland, and the spleen, guys. Look at the tail of the pancreas that's inserted inside the ligament known as splenorenal ligament. Connects the spleen, of course, to the kidney. So the location of the tail in this ligament and close to the hilum of spleen make it like risky when the patient has splenectomy. When they remove the spleen, this make the tail of pancreas at risk for injury. What does it mean? Okay, I will tell you. Look at the tail of the pancreas, located in this ligament between the spleen and left kidney. So in case of splenectomy, when they remove the spleen for a reason or another, this can sometimes jeopardize the tail of pancreas and creates a kind of injury to the tail. What does it mean? That means some of the secretions or enzymes of the pancreas can be leaked out into the abdominal cavity, and this can create a kind of damage and serious and has really serious consequences on the organs and the structures there, because you know these enzymes from the pancreas should be normally secreted into the duodenum, not into the abdominal cavity and different organs, because they can digest the fat, carbohydrate, and proteins. So that's the one of important clinical significant point related to the pancreatic tail and splenectomy. And have a look on the ducts inside the pancreas. Look at it here on the right upper abdominal figure, in which the duct exposed. Well, guys, if you focus on the duct, you will see that's composed from one like main pancreatic duct, this one, and we have another accessory duct known as accessory pancreatic duct. So we have main and accessory pancreatic ducts. So the main pancreatic ducts, guys, extend from the tail of the pancreas all the across the length of the pancreas toward the head. Once it reaches the head, look at the main pancreatic duct, it turns inferiorly into the head, and again a little bit to the right toward the second part of the duodenum. Now this is the main pancreatic duct that opens in the second part of the duodenum at the major duodenal papilla. Now, what about the accessory pancreatic duct? Yes, it opens usually in 70% of people in the minor duodenal papilla, which is located just a little bit above the major duodenal papilla. So this is the accessory pancreatic duct. If you follow the accessory pancreatic duct from the minor duodenal papilla, you will find it after a while it divides into upper part that continues to the left and lower part anterior to the main pancreatic duct all the way down until it reaches the uncinate process. So this is just a description for the main and accessory pancreatic ducts, and as I mentioned, guys, that the major pancreatic duct and minor pancreatic duct usually open the second part of the duodenum in the posterior medial wall of the second part of the duodenum, which is important. 70% of the accessory pancreatic duct opens into the minor separately into the minor duodenal papilla, but this is 70%, but 30% sometimes they join the, which is these kind of variations, right? Joins the main pancreatic duct and open to the second part of the duodenum via the major duodenal papilla. Now, guys, you have to know that the main pancreatic duct, of course, joins the common bile duct, or what known as bile duct, to form like a part which is like large or enlarged part known as hepatopancreatic ampulla. This is the ampulla, hepatopancreatic ampulla, because you know something related to the bile duct and pancreas. Yes, hepato because the bile synthesized in the liver and stored in gallbladder, then from gallbladder through the bile duct as secreted into the duodenum. So what I want to say, guys, that look at the here the bile duct on the right side. Here is, guys, the bile duct, and this is the main pancreatic duct. They join to form hepatopancreatic ampulla, like dilatation, any dilatation known as ampulla. We have many in our body, right? So any dilatation, if this is regular, then it's dilatation like that. So we call it like ampulla, like the ampulla of the drug or of medicine. So yes, this is the hepatopancreatic ampulla, or known ampulla of water. Ampulla of water. This is very important because usually they use ampulla of water. Hepatopancreatic ampulla is too long, right? So this is ampulla of water. However, the ampulla of water, guys, ultimately will open into a small duodenal papilla here, the major duodenal papilla. Of course, above it we have the minor one, which is not shown here. So what about the sphincters, guys? Yes, the bile duct itself guarded by a smooth muscle, which is the creates a kind of a sphincter of bile duct, and we have similarly a sphincter on the pancreatic duct as well. And on the, you know, when they join each other, they form ampulla. This is ampulla of water, or hepatopancreatic ampulla, and it has also its own sphincter. So this is so we have three sphincters for the bile for pancreatic duct as well, and for the ampulla of water, and the sphincter here for the ampulla of water known as sphincter of Oddi. Sphincter of OD. So also clinically they will not use sphincter of hepatopancreatic ampulla, it's too long, just sphincter of OD. So the sphincter of hepatopancreatic ampulla is the sphincter of OD. And let us shift now to the to talk about the blood supply of the pancreas, and I would like to divide it into blood supply of the head and blood supply of the body and tail. And well, guys, I would like to remind you first of all about the blood supply of duodenum. Do you remember the blood supply of duodenum? I would think you say yes. It has its own blood supply from. It has the its blood supply from the celiac trunk and superior mesenteric artery. Well, guys, I would like to iterate again. It's not iteration, but it's very close to the blood supply, or I would say the same of blood supply to the head of pancreas. So the head of pancreas gets its blood supply from the celiac trunk and from the superior mesenteric artery, in which I think you remember that the celiac trunk gives a couple of branches. One of them is the common hepatic artery. The common hepatic artery gives the gastroduodenal artery that passes behind the first part of duodenum. Anyway, it divides again into the anterior pancreaticoduodenal artery and posterior pancreaticoduodenal artery. Yes, pancreaticoduodenal artery, that means to the duodenum and to the pancreas, to the head of pancreas. So this is the superior one, but the inferior one comes from the superior mesenteric artery that gives the inferior pancreaticoduodenal that divides into again anterior one that joins the anterior superior one and posterior one that joins the other inferior, the posterior one. So I would say that the superior pancreaticoduodenal artery and the inferior pancreaticoduodenal arteries, they anastomose between the right lateral border of the head of pancreas and the duodenum here. It creates a kind of anastomosis here. So ultimately from celiac and superior mesenteric through the blood vessels that we mentioned. Now, what about the rest of the pancreas? Yes, the body and tail, look at it here. They got their blood supply, which is easy to remember, from the splenic artery. Look at the celiac trunk that gives the splenic artery. This artery is tortuous in nature, متعرج, and from its name, splenic artery, so it gives blood supply to the spleen, but it passes on the upper border of the pancreas, as you see, and it gives a couple of pancreatic arteries because it passes on the upper border of pancreas, and of course it will supply at least the body and tail. So mainly it has these two branches, the dorsal pancreatic, and in the middle of it you have the greater one, and the dorsal, we have dorsal and the greater. The dorsal gives divided to give inferior one that passes along the inferior border of the pancreas, guys. So as I mentioned, you have dorsal and the greater pancreatic arteries, and from the dorsal you have inferior pancreatic one. Now, what about the drainage of the blood from the pancreas? Well, guys, and from the end, ultimately the blood will return to this large vein, this portal vein that drains the blood from almost of GI tracts and organs. So this is the portal vein, and you remember that behind the neck of pancreas, which is important. You see the shadow part that indicates the neck of the location of neck of pancreas, because we cut the pancreas, right? So you know that the superior mesenteric vein united with the splenic vein behind the neck of pancreas to form the portal vein. However, the blood from the pancreas returns to the follow the arteries, right? So look at it here, to the superior mesenteric vein, and guys, also to the splenic vein, as you see here. So ultimately, the splenic vein will unite with superior mesenteric with all these veins to form the portal vein. So the drainage will be to the superior mesenteric vein and splenic vein that unite to form the portal vein. Also, if you look here, well, I would like guys to say this. I know we mentioned that, but there is variations, especially in the veins. So some of veins, look at this one, from the head of pancreas, it drains into the portal vein itself, right? And usually they take the same name of the arteries, right? For example, this is the posterior superior pancreatic duodenal vein. So that was the venous drainage, but what about the lymphatics? As I always say, most of the time, guys, the lymphatics and deep structures, deep organs will follow the blood vessels, mainly the arteries, right? So the pancreatic lymphatic vessels also, the lymphatic vessels will follow the blood vessels. Let me show you. First of all, look at the spleen and pancreas. You know there is a splenic artery here, right? So the lymphatics, lymph nodes, that is neighbor to the or across the splenic artery. So these lymph nodes from the pancreas and spleen, known as pancreatico-splenic lymph nodes. So they drain the lymphatics from the spleen, from the tail of pancreas, and from the body. Yes, then from the pancreatico-splenic lymph node will be drained, guys, into superior mesenteric lymph nodes around superior mesenteric artery. So what I want to say when I said the pancreatic lymphatic vessels follow the blood vessels, that means I have to remember the blood supply of pancreas. And I mentioned the blood supply of pancreas from splenic artery, from celiac, from celiac trunk, right, and superior mesenteric artery. So the lymphatics will be celiac lymph nodes, superior mesenteric lymph nodes. So these ultimately will be the drainage will be to the celiac lymph nodes, superior mesenteric lymph nodes. But a little bit extra details I will give it to you guys, that from spleen and the pancreas, here you have as pancreatico-splenic nodes. Then they will drain, of course, the spleen, tail, and body of pancreas to the superior mesenteric lymph nodes around superior mesenteric artery. Excellent. Now, also, guys, we have a drainage of lymphatics that drain into, of course, pyloric lymph nodes, and then from pyloric lymph nodes to the hepatic lymph nodes, the green ones, then from hepatic lymph nodes to the ultimately celiac lymph nodes. So this is the lymphatic drainage of the pancreas. Innervation of pancreas, guys. Well, simply you have sympathetic and parasympathetic innervations. Simply the parasympathetic, as you know, usually from the vagus nerve, and sympathetic will be from the abdominopelvic splanchnic nerves. So these splanchnic nerves, look at it here, the yellow color indicates or indicating to the sympathetic nerves. So the splanchnic nerves, guys, with parasympathetic fibers from vagus nerve, the blue color, they unite with each other to form plexuses around the celiac trunk and plexus around superior mesenteric artery. So the plexuses around the celiac trunk and superior mesenteric, known as celiac and superior mesenteric nerve plexus, though they are mixed of sympathetic and parasympathetic. So the plexus usually, as you see, is a mix of sympathetic and parasympathetic. So the pancreas gets the blood supply from celiac and superior mesenteric plexus. Now, unfortunately, guys, sometimes cancer of the head of pancreas is a big problem, especially with the indeed the anatomical relation. If you look here to the blood supply of the head of pancreas and the relation of the head of pancreas to the bile duct, as you see here, this is posterior view, right? And with the duodenum, so the head of pancreas, bile duct, duodenum, the blood supply for that, these anatomical relations, complex anatomical relation, make it impossible to remove the entire head of the pancreas, like in a procedure known as pancreatectomy. When they remove the pancreas, they cannot completely remove the head of pancreas because for the reasons I mentioned earlier. So usually a rim of the pancreas is returned along, guys, the medial border of the duodenum. Why? Well, guys, in order to preserve the duodenal blood supply. And look at it here. So when there is a tumor in the head of pancreas, it makes a kind of compression on the bile duct that passes in the groove behind the head of pancreas, then penetrates its substance. And for this reason, a blockage of the bile duct will lead to what known as obstructive jaundice, because the bile will stay in there in the gallbladder and the secretion of in the liver will be affected. Then this will be shown under the skin, so known as obstructive jaundice. So the jaundice sometime, and not always, is a sign of cancer of head of pancreas, right? Or any cause of obstruction of bile duct, stone or whatever. So also, guys, I would say because of the location of the pancreas most posteriorly in the posterior abdominal wall behind even the peritoneum. So it's very back, right? So pain from the pancreas, remember that, guys, will referred to the back. So some patients complaining from inflammation of the pancreas, they complain from back pain. Furthermore, because its location behind, as you know, behind the stomach and transverse colon, a pain from stomach or disease or pain from stomach and transverse colon sometimes can be confused, or disease of those two structures, I mean stomach and transverse colon, and because of their relation to the pancreas can be confused with it. So you don't know sometimes from pancreas or from stomach or transverse colon because of their close relationship to each other. And from that relationship with like this the stomach and behind it, the pancreas, guys. So inflammation of the pancreas can spread to the peritoneum, especially to the lesser sac that's behind the stomach. Let me show you what I mean. You remember that? This is the stomach. So So there is a space between this is the lesser sac, the space between the pancreas and the stomach. So inflammation of the pancreas can spread to this peritoneum cavity, small peritoneal cavity that known as lesser sac. Of course, you know the lesser sac communicates with the greater sac outside. So that means to the peritoneal cavity. So infection can spread to the peritoneal cavity. So yes, back to this is our references, guys, and thank you.